Good afternoon, everyone. Thank you for joining us for today's LEAD Center webinar, LEAD Center Inaugural Year in Review. My name is Elizabeth Jennings. I'm the Assistant Project Director for the LEAD Center, and I'm going to be your facilitator today. We have a great lineup of speakers for you, including Karen McCullough, our Project Director for Year 1 of the LEAD Center and current Director of Special Projects, Kelly Buckland, Executive Director of NICL, Angie Siegler, Director of Employment and Vocational Services for Paraquad Center for Independent Living, Michael Morris, Executive Director of National Disability Institute and LEAD Center Public Policy Team Lead, Bobby Silverstein, Principal at Powers, Piles, Sutter, and Verville, and our new LEAD Center Project Director, Dr. Rebecca Salone. For those of you who haven't joined us before, the National Center on Leadership for the Employment and Economic Advancement of People with Disabilities, commonly called the LEAD Center, is a collaborative of disability, workforce, and economic empowerment organizations led by National Disability Institute with funding from the U.S. Department of Labor's Office of Disability Employment Policy. Before we go any further, I'd like to take a moment to acknowledge our colleagues at the Office of Disability Employment Policy and invite Chris Button, Supervisory Policy Advisor with the Workforce System Policy Department, to offer a welcome.
Thank you so much, Elizabeth. I'm sitting here in a room full of folks here at ODEP, and we are really excited to be sharing with folks across the country the activities and outcomes of the LEAD Center's first year of work. You know, employment, economic, and advancement and leadership are three pretty big terms, and I think really that LEAD's making an incredible difference in all of these areas already in just the first year. From looking at kind of the nexus of employment with Medicaid and health care, to blending and braiding resources and expertise across systems, both disability and generic, to promoting partnerships both at the federal level and at the state implementation level, to bringing entities, really important partners to the WIA system like the Centers for Independent Living, to generally helping ODEP with a variety of policy analysis activities. We have been really honored, honestly, to be able to say that the LEAD Center truly is a partner to us at the staff level in helping to move a progressive public policy agenda through the range of activities that it is implementing. And of course, with amazing staff, both those who are on the phone today as well as other national consultants who are helping us to implement projects across the nation. So I'm really excited about the webinar, really excited to share all this exciting stuff from this year with the nation, and also looking forward to equally exciting activities for next year. So thanks, Elizabeth.
Thank you so much, Chris, and we're very happy to have you all back. I'm now going to offer a moment for my colleague, Nakia Matthews, to offer you some housekeeping tips.
Good afternoon, everyone. The audio for today's webinar is being broadcast through your computer. Please make sure your speakers are turned on or your headphones are plugged in. You can control the audio broadcast via the audio broadcast panel, which you see an image of here below. And if you accidentally close this panel, or if the sound stops or becomes unintelligible, you can reopen the audio broadcast panel by going to the top menu item, Communicate, Join Audio Broadcast. If you do not have sound capabilities on your computer or you prefer to listen by phone, you can dial the number you see here with the meeting code. And please note that you do not need to enter an attendee ID. Real-time captioning is provided during this webinar. The captions can be found in the Media Viewer panel, which appears in the lower right-hand corner of the webinar platform. If you'd like to make the Media Viewer panel larger, you can minimize some of the other panels like Chat, Q&A, or Participants. And conversely, if you do not need the Media Viewer panel, you can minimize it. There will be a question and answer portion at the end of the webinar. Please use the Q&A box or the chat box to send any questions that you may have during the course of the webinar to me, Nakia Matthews, or to Elizabeth Jennings, and we will direct the questions accordingly. If you are listening by phone and not logged into the web portion, you may also ask questions by emailing Elizabeth directly at ejennings@ndi-inc.org. Please note this webinar is being recorded and the materials will be placed on the Lead Center website at the URL you see below. If you experience any technical difficulties during this webinar, please use the chat box to send me, Nakia Matthews, a message, or you may also email me at nmatthews@ndi-inc.org.
Thank you, Nakia. Today we're going to provide for you an overview of the Lead Center's Year 1 efforts, the initial findings of one of our demonstration projects, the Lead Center CIL pilot project, an overview of the public workforce system's policies and practices related to serving job seekers with disabilities. Then we're going to do a quick preview of the Lead Center's Year 2 efforts to give you an idea of what's still to come next year. We're going to leave some time for questions and answers, and for those of you who are new to the Lead Center, we're going to provide you with some information on connecting with the Lead Center so you'll be updated on activities and efforts as we head into Year 2. We hope that by the end of the webinar, you will have a better understanding of the Lead Center's Year 1 efforts, the initial findings of the CIL pilot, the public workforce system structure for serving and supporting customers with disabilities, the Lead Center's plans for Year 2, and how to stay up to date on Lead Center news, including training opportunities. I'd now like to take a moment to introduce you to Michael Morris, Executive Director of National Disability Institute. He's going to provide you with an overview of the Lead Center's history and priorities and our Year 1 efforts. Thank you, Michael.
Thanks, Elizabeth. Let me take you first to the background and history of the Lead Center. The National Disability Institute was an applicant to the Office of Disability and Employment Policy, and we were successful, and the result was the establishment of the Lead Center in October of 2012, just a year ago. Our focus is on employment, economic advancement, and leadership, with particular attention in how we can continue to develop and reform public policy for the benefit of people with disabilities nationwide. Our collaboration within the Lead Center involves 7 other national organizational partners, 9 subject matter experts, and 16 knowledge transfer dissemination partners. So our reach has been pretty extensive, both in Washington, D.C. and across the country. The mission of the center is to advance sustainable individual and systems level change that results in improved, competitive, integrated employment and economic self-sufficiency outcomes for individuals across the full spectrum of disability. Let me share with you some of the highlights from our Year 1 efforts. First, and as I mentioned just a moment ago, we have worked with a dynamic consortium of strategic partners to implement a comprehensive high-impact work plan that cuts across 5 goals. Our goals relate to bringing innovation to scale. It relates to public policy. It relates to really increasing capacity of the workforce investment system to better serve people with disabilities. We have identified systems issues and developed policy recommendations and tools to improve integrated service delivery, employment, and economic advancement for youth and adults with disabilities. A highlight of the year took place in July when we conducted our first annual policy roundtable on the topic of blending and braiding resources across multiple public funding service delivery systems. We were able to bring together some 50 individuals representing government, the research community, practitioners, the workforce development system, policymakers and decision makers at a federal level, state level, and local level. We are working now on compiling the findings from the roundtable, and we'll have soon to you recommendations for policy change across federal agencies and some very specific to individual federal agencies and service delivery systems. We were also able in the first year to bring together in a one-of-a-kind first meeting of a knowledge translation consortium of federally funded training and technical assistance centers. So these were centers beyond those funded by ODEP, Office of Disability Employment Policy, and ETA, Employment and Training Administration. We also brought together other centers that were funded by other federal agencies within the Department of Education, within the Department of Health and Human Services, the Social Security Administration. And what we really started to do, and we will continue during year 2, is to look at ways we can better collaborate, coordinate resources, and make it easier for all of you, multiple target audiences, people with disabilities, professionals, workforce investment providers, the business community, figure out ways that it will be easier for you to identify the resources we have available and better able to work together to meet that common mission of advancing employment and economic outcomes for people with disabilities. During the first year, we provided almost monthly a webinar, 9 webinars in all, and there were over 3,185 participants who participated online as well as on-the-ground, on-site training events. We held 2 group discovery Train the Trainer events in Kansas. We participated in a Cities for Financial Empowerment Fund forum in Miami. We participated in the annual conference of the National Association of Workforce Development Professionals, and we also participated and made up a panel in a breakout session at the National Council on Independent Living. We were able early on in our first year to launch the LEAD Center website. If you haven't been there yet, I hope you will take the time today and visit with us at www.leadcenter.org. It is a one-stop hub for overall project information, as well as news and news feeds from current articles across traditional and new media that would impact people with disabilities and their advancement of their employment and economic status. All our webinars are archived on the website. We have a regular blog. We have a calendar of events. We have a resource center where you can access many other materials. We also have a quarterly e-newsletter that you can sign up for. And we are also engaging people through social media, Facebook, Twitter, LinkedIn, and YouTube. In our first year, we were very fortunate to have engaged you and so many others, a total of 2.1 million impressions made through our social media presence. To continue about our first year efforts, we also are engaged with research with a national employer to better understand their return to work and workplace flexibility policies and practices from both a national corporate level and local level. We're trying to learn more in terms of workplace flexibility, in terms of ways to keep people to stay at work despite primary or potentially secondary disability conditions, and also when someone has come out of the workforce, can we help them return to work? We're also completed a survey with the U.S. Business Leadership Network and its corporate members to identify policies and practices related to workplace flexibility and mature workers. We're finishing up a demonstration project called Secret Shopper, where job seekers with invisible disabilities have collected data from their visits to American Job Centers to help us better understand ways to improve service delivery and effective and meaningful participation of people with disabilities within our workforce investment system. We are very much engaged with Centers for Independent Living in 5 locations to foster greater partnerships between CILS and the American Job Centers, AJCS, to increase the opportunities for people with disabilities as customers, as job seekers, to gain access to not just core services, but also intensive and training services, and ultimately achieve better results in terms of employment outcomes. So hopefully you get a sense of the breadth of our work. This is just some quick highlights. I do urge you again to visit our website, and what I'm going to do next is turn to several of my colleagues to talk with you in a little bit greater depth about some of our demonstration projects. In particular, the first one just mentioned about our work with Centers for Independent Living, and I'm going to call on Karen McCullough, who is leading this work, working with Nickel, and she will take it from there.
Thank you very much, Michael. The Center for Independent Living demonstration project has been developed from the grassroots level, and that means that it never existed before. So we're partnered with and continue to partner with the National Council on Independent Living and the National Association of Workforce Development Professionals. Nickel, in particular, has been a very strong partner with us on this project, and I'm going to very quickly move over to ask Kelly Buckland, who is the Executive Director of the National Council on Independent Living, to share with us how we got started and establishing the eligibility for the criteria that we use to select CILs. Kelly?
Thanks, Karen. Hi, everybody. It's a real pleasure to be here with you today. As Karen said, we've really worked closely together on this project, and we wanted to make sure that we covered several things when we recruited the centers to participate in this. So we basically set up some basic eligibility criteria, if you will, that kind of set up a way for us to make sure that we covered all the bases. So we wanted to make sure that the centers that were participating had like an established employment program going on within their center and a benefit planning expertise, if you will, amongst the staff that are working at the center. We wanted to make sure that we had a good geographic representation and a good diversity within the population across the United States. So we tried to pick centers that would provide that geographic and population diversity. And we also wanted to pick centers that had an established linkage with their American Job Centers. So we went about recruiting centers, and we went through quite a few, but we ended up selecting really some great centers, I think, that participated in the program. That were, there was 10 of them all together, and I'll go back, if you go back to slide 20, please. One was Independence First in Milwaukee, Wisconsin. The other one was the Disability Rights and Resources Center in Birmingham, Alabama, and some of you may know that was the center run by Dan Kessler, who was the president of Nickel at the time. Paraquat in St. Louis, Missouri which has had an ongoing employment program for a long time. And the Montana Independent Living Project, we were particularly pleased to get these guys on board in that they were representing a rural area in Helena, Montana. And then the Community Resources for Independent Living, which is in Hayward, California. And those 10 centers really we thought had a good diverse geographic distribution and diverse population, and so you can see kind of why we picked those. The impact on the public policy by involving the CILs in the public workforce system was something we think are going to accomplish by hooking them up with their job centers. And we really are looking for these guys to come up with promising and best practices to produce what we can replicate models for other CILs to utilize and improve the employment outcome of job seekers with disabilities. And we want to, like we said, replicate this so that we can expand the CIL impact and expertise to create systems change. And I can tell you that I've already learned that centers have much more involvement in employment than even I thought that they did. And we think by doing that, we will also improve the service delivery through the American Job Centers. So we've had a good first year, and at this point, we're going to present some stuff that'll give you some results of what we came up with. So with that, I'll turn it back over to Karen McCullough. Karen?
Thank you very much, Kelly. Kelly was instrumental in recruiting the CILs for this demonstration project, and thank you again for that. We had to take a step back and say, in developing this demonstration project, what was needed. And in collaboration with ODAP and the 5 CILs, we had a discussion, and we actually have developed some pretty dynamic materials for the Center for Independent Living Toolkit. The first thing that we created was a letter of introduction for the CILs to use and present to the American Job Centers, which was signed by ODAP and the lead center that basically told them what the CIL staff were doing. We also developed a fact sheet that the CILs could present to the AJCS so they would understand the pilot project better. We created a checklist for the CILs to use prior to them sending the job seekers over to American Job Centers to get started. And that was, in part, we wanted the centers to actually visit their American Job Center so they would get to know them, they would introduce themselves, they would have a chance to be on the premises, and then they would be able to work with the job seekers to let them know what to expect when they actually visited an American Job Center, what they might be able to ask for, and what to expect. And we hope that that would help. And the feedback we're getting from the CILs is that it is helping. We also developed a disability awareness and etiquette guide for use by the CILs to provide training to the AJCs who were requesting this. And this guide was actually developed in collaboration with the lead center and the Job Accommodation Network. We developed an AJC guide for the Centers for Independent Living that helped them understand better the Workforce Investment Act and the AJC services that are provided. And the last thing that we have developed is an acronym and glossary guide of terms used with the public workforce system. And as we know, different systems have different language and different acronyms, so we're hoping that this will be very useful as well. So the interesting thing for us is, of the 5 CILs, they are working with 16 different local American Job Centers. And I think it's important that when we say developing partnerships, the partnerships are between 2 entities, the CILs, and I thought it was important for us to recognize those American Job Centers that the CILs are working with. In Alabama, at Disability Rights and Resources, they're working with the Jefferson County Career Center in Birmingham. and in Jasper, the Walker County Career Center in Jasper, Alabama, and Alabaster in Shelby County Career Center in Alabaster, Alabama. And I want to say that in this Center for Independent Living is also working in the satellite areas, which is also representing more rural areas as well as city. Paraquad, which is located in St. Louis, is working with the St. Louis County North Oaks St. Louis, Missouri Center, the Slate, Missouri Center in St. Louis, the Slate Downtown Center in St. Louis, and St. Louis Career Center, Seven Hills in Florissant, Missouri. Independent First in Milwaukee, Wisconsin is working with the Northeast Comprehensive Job Center in Milwaukee, the Milwaukee Job Center Central in Maximus in Milwaukee, and also the Southeast Comprehensive Job Center in Milwaukee. Out in Montana, which we call our frontier state, and we're very happy to have them on board as well, the Montana Independent Living Project is working with Bozeman, Montana Job Center, Butte Job Services in Butte, Montana, and the Helena Job Service Center in Helena, Montana. And our CRIL, which is our Community Resource for Independent Living, is working in the Alameda County AJC in Hayward, Eden area, Hayward, California, and the Tri-County Career Center in Pleasanton, California, and the Tri-Cities Career Center in Fremont, California. So as Kelly had shared with you, we were looking for geographically diverse and also population diversity in the choice of the CILs, and I think we represent that from the geographic areas that I've described. We also needed to set up an online questionnaire to collect data on job seekers and also develop a separate instrument to learn about what types of CIL trainings were occurring and some of their other activities. And they have actually, we have begun to see quite a few results. I believe we had 57 AJC staff and workforce investment board members going through some type of training in the last couple of months. As of the close of year one, the 5 participating CILs have collectively served 47 job seekers, and we have statistics on 45 of those job seekers, which I would like to share because I think it's very interesting. What we know is, and I'm very pleased to say, as we look at the sequential development of this program, where by January we had the CILs on board, and we went through this educational process with the CILs. They actually did not start recruiting and enrolling job seekers until June 1st. So since June 1st, we have 8 job seekers who have obtained employment. 6 are employed full-time and 2 are employed part-time. And the job seekers are diverse. The age range is from 16 to 63. We have 26 women and 21 males enrolled. 44% are Caucasian and 44% are African American, 6% Hispanic Latino, 4% Asian. And it's interesting because we didn't know what the disabilities would be represented by job seekers that they would be working with. And what we found is that 15 individuals were identified as having mental illness or some type of emotional challenge, and 13 had cognitive developmental disabilities. We have 8 who have physical or mobility challenges, and we had 3 with learning disabilities. 2 were identified as hidden, 2 had low vision, one job seeker is blind, and we had 1 individual that was identified with spinal cord injury. So what is really encompassed here in our report on this is that we have our leader from the National Council on Independent Living who helped us recruit the CILs, and we have the CILs really working so closely with the LEAD Center and with ODEP. But today we also have one of those CILs represented who is going to sort of tell their story from the field. I would like to introduce to you Angie Siegler. And Angie comes to us with very unique knowledge. She worked 6 years with the One-Stop American Job Centers, and she left that position and went over to Paraquad Center for Independent Living in St. Louis, Missouri. She is the Director of Employment and Vocational Services, and when I was discussing with her some questions in regard to what she would like to answer for this, I did ask her, why was Paraquad interested in participating in the CIL demonstration project? How has Paraquad participation had an impact on job seekers with disabilities, and the development of partnerships with local American job centers? And what outcomes does Angie see from Paraquad's point of view will be the result of Paraquad's participation in the CIL project? So it's my privilege to introduce you to Angie. Angie, thanks for joining us.
Oh, thank you so much, Karen. And I want to thank the Lead Center for this opportunity to advocate for and impact the lives of those that we serve here at Paraquad. So I guess I'll answer your first question first, why Paraquad was interested in participating in the CIL demonstration project. When I saw that the project was out there, and also as a former staff member at the AJC, I really knew that the local Career Center could do better in helping individuals with disabilities, particularly in accessing and navigating the services at the AJC. So I've thought that with this project that there would be an opportunity for the Paraquad staff and the local AJC to really collaborate and strengthen the service delivery system at the AJC. And also from working at the AJC and then also coming to Paraquad, and anecdotally, many of the participants in the Paraquad employment program, they've shared negative experiences at the AJC, and they've talked about only having a referral to vocational rehabilitation as their only service option. So I really wanted to do what I could on my end on behalf of Paraquad to help our participants with disabilities go into the AJC and get the services that they need and not be siloed to a particular staff member who, oh, well, that person only works with people with disabilities, so and that person isn't here right now, so can you come back next week? So we were hearing a lot of that. We really wanted to help the Career Center, engage those participants and give them the opportunity to use the services of the Career Center. So it kind of became a personal quest to ensure that all of the staff members at the Career Center could interact whenever possible with a wide variety of participants rather than just being siloed or being a specialist to a given population. So I was thinking that developing a partnership between Paraquad and the AJC would really allow us to combine our resources so that they could be used in a more efficient fashion, and that would be beneficial to the individuals in our catchment area. So I saw it as a two-way street that the AJC could benefit from the expertise of Paraquad staff and use our guidance, resources, and some trainings as an opportunity to strengthen their service delivery model. And we could benefit because our particular participants are looking for jobs. We're trying to help them with that. Our Career Center sponsors and hosts a lot of job fairs and a lot of seminars and different type of activities that if we could engage our participants in those activities, that would help them with their networking and help them find a job. So the next question is, how has Paraquad's participation had an impact on job seekers with disabilities and the development of partnerships with local job centers? Initially, we were able to provide the participants or the job seekers that came to us, the 10 that we sent through and tracked those outcomes for the project, we were able to provide, before we did anything, some really intensive training on the self-advocacy skills that would be helpful so that our participants could engage in the services at the AJC. We've been able to talk to our participants about the processes, the way they do things at the AJC, some of the assistive technology that's available at the AJC, how to ask for a reasonable accommodation, to really explain their story so that, and be comfortable with that, so that they could receive the services that they need. And also, we have helped, Paraquat has helped the AJC make, ensuring that their facilities and their services were accessible not only programmatically but also physically. Let's see. We also worked with our participants on the way the job seeker services at the AJC work, how to access job listings, how to get involved in the employer interviews, the information sessions that they have, how to access training dollars. And we actually have someone that, has been approved for training dollars. So that's huge. We're not aware of anyone with a disability that's ever been able to do that before. So that was great. As far as our CIL and the impact of this demonstration project on the AJC, it's been phenomenal, because sometimes, just the training, sometimes you don't know what you don't know. And so we've been able to provide the training to the staff about the service delivery options available to job seekers with multiple barriers to employment, how to help these job seekers determine their best employment options. We have conducted lots of cross-training to promote that relationship building between the various partner agencies. We've had vocational rehabilitation involved. We've had other local disability providers and our CIL staff and the job placement and the training staff and the administration at the local AJC. And we've talked about and trained in areas like job search techniques, job development, job support strategies, reasonable accommodations, and it's been a great partnership. One of the things that was really important too, as we were having conversations with the AJC staff, is that we designed a needs assessment to really help them identify their training needs and the training needs of the other partners. We have about 20 partner agencies that are represented in our AJC as a one-stop career center, and there were lots of strengths that were already in the career center. So we were able to pull everyone together and come up with a priority of trainings that would really, impact the participants with disabilities or multiple barriers to employment. We also provided some technical and much needed assistive technology training so that when our participants would go into the Career Center, they wouldn't be told, well, come back next week because I don't know how to work that particular telecommunication device, or I don't know how to make this workstation accessible for you, and the person that normally does it isn't here. So we made sure everyone was trained, and then we invited in some of our participants, and the staff then was able to have a hands-on training where they were very comfortable with how to use the technology and kind of some of the ideas behind it, so that they could, incorporate that into their service delivery model. And I think the outcomes as a result of Paraquat's participation in this project is that you know, our AJC now, they have the training and resources to help individuals with disabilities access services. We get calls every day from staff at the AJC saying, you know, we talked to someone today and we talked to them about services that they've received in the past, and, you know, we were thinking about this, and this on their, you know, employment plan. And that's been really great that people are starting to use the tools and the information that we've provided to, you know, really make that AJC completely accessible to people with disabilities, you know, in terms of both physical accessibility and service delivery. I really feel like that we were able to walk in the door and help open the door for the job seekers with disabilities. And I think probably the best outcome is that from a business vantage point, we know that finding qualified employees is really a challenge for public and private sector employers, you know, of all sizes. So we have offered the opportunity, I feel like, for our participants to go to the Career Center to use the AJC resources, and then, you know, an employer is going to get this great talent to expand their talent pool, and that includes candidates with disabilities. And I think that and accessing, you know, the services that, you know, our clients need in order to get a job and achieve their goals, you know, really are the most important outcomes. So I'll turn it back over to you, Karen, and thank you so much for letting me participate.
Thank you very much. Angie, I'm sitting here thinking about, with a smile on my face, hearing you talk, because what I hear you say is that the AJCs as partners now know that they can pick up the phone and call you if they need some assistance on knowing how to accommodate someone, and you're providing the resources and training at the AJCs where you feel as though that they are providing better service delivery. Well, just to round this out before I turn this back to Michael, the CILs and ODEP partners and Lead Center staff and NICL are all on a monthly CIL call just to discuss what's happening. A lot of dialogue is now beginning to occur in the sharing across the CILs, which I think is really a very positive outcome as well as this project. So we are not done yet. This program does not end until the end of the year. And so I know each center was to be working with 10 job seekers. We are up to 47, and I'm sure within the next couple of weeks we will have met our goal of 50 job seekers associated with centers. So thank you very much, Kelly and Angie, for participating in this segment of the webinar, and I'm delighted to turn this over to Michael Morris to pick up on the next segment. Michael?
Thanks, Karen. Terrific presentation, and I know when we started a year ago, this is everything we had hoped for in terms of what Paraquat is doing in St. Louis and what the other pilot sites are doing in their respective cities, is opening up a world of possibilities of shared expertise and resources between the staff at independent living centers and the staff at American Job Centers. And the possibilities are somewhat almost endless. So terrific. I think what we've learned from this pilot to date is that AJCs are really underutilizing the expertise of Centers for Independent Living, and as well, Centers for Independent Living are not fully utilizing a resource in their own backyard, American Job Centers. So we're building the bridge, we're showing it can work, and the toolkit that's being developed is helping us realize that we're going well beyond theory and abstractions, that AJCs truly can serve all job seekers, including those with disabilities. Our end goal will be that what can we do to further improve and enhance the policies and practices of the workforce investment system, the public workforce system nationwide, and that will be some of our work in year 2. But I think what you presented today gives people a great snapshot of the potential that's out there, and we'll continue to look at replicating these promising practices and sustaining them through further policy and practice development. So if we can go to the next slide, we're going to turn to a second part of our presentation today, and that is the work we've been doing in policy with subject matter expert Bobby Silverstein, who I've worked with for many years. 10 years ago, we worked with ODEP in looking at Section 188 and looking at responsibilities under the Workforce Investment Act to people with disabilities. And the result of that is at one point in time was a disability checklist you'll hear a little bit more about. But let me really turn it over to Bobby to give you an overview of the work he's doing, which we feel can truly lead to further replication of promising practices and policies within the workforce investment system nationwide. So Bobby, let me turn it over to you.
Thank you very much, Michael. One statement that Michael made summarizing the work with the Centers for Independent Living, I think, is very critical. And that is the responsibility of America's job centers to serve all job seekers, including job seekers with disabilities. And that's why the enactment of the Workforce Investment Act on August 7th of 1998 was so critical for people with disabilities and others experiencing multiple barriers to employment. Because with the passage of the Workforce Investment Act, Congress and the President basically changed the paradigm for people with disabilities in these one-stops, career centers. Historically, prior to WIA, we had the JTPA, Job Training Partnership Act, and before that we had CETA. And basically under the previous legislation, if a person with a disability showed up at a one-stop, whatever it was called at that point, they were basically told, sorry, we don't serve you, go to voc rehab, go to other agencies, state agencies, local agencies serving people with disabilities. With the enactment of the Workforce Investment Act, Congress changed that paradigm to say that all means all, including people with disabilities. So the state plan requirements specify that the state must describe how it will meet the needs of individuals with disabilities. State workforce investment boards and local workforce investment boards are now responsible for determining how best to organize the service system to effectively serve people with disabilities. The governor is responsible under Section 188 of the Workforce Investment Act to develop and submit what's called MOA, Methods of Administration Program Plans, to the Center the Civil Rights Center within the Department of Labor. And one part of that MOA deals specifically with implementation of programs for people with disabilities consistent with the non-discrimination provisions in 188, consistent with the ADA, consistent with Section 504 of the Rehab Act. And as Michael made reference to, on July 22nd, 2003, the Department of Labor issued the WIA Section 188 Disability Checklist, which deals with not only physical but programmatic accessibility for people with disabilities, sets out a number of questions dealing with compliance, and provides a series of examples of non-mandatory practices that America's Job Centers may adopt. Next slide, please. One of the project's initiatives that the lead center identified as being critical was to basically do a comprehensive review of the state of practices, policies, and procedures affecting people with disabilities in America's Job Centers, to just look at all the creative, innovative, promising, emerging best practices that the one-stop, so the American Job Centers were actually using, and trying to identify these practices so that we could share them with others around the country. So working with NASWA, that's an Association of State Workforce Agencies, working with the Civil Rights Center and the Employment and Training Administration and DOL, and working with folks at ODAP and the DEI, the Disability Employment Initiative grantees, we did a comprehensive survey looking to identify these practices. And a preliminary survey has been completed. We will share our results with ETA, with the Civil Rights Center in the Department of Labor, with ODAP, and then eventually share it more comprehensively with folks around the country. What we did, next slide please, is identify a series of topic areas where these innovations are occurring. And these innovative practices include having dedicated staff, practices dealing with marketing and outreach, consultation with community groups, operational collaboration, partnership and linkage agreements, training of staff, the actual registration and orientation function, and the use of person-centered employment planning, integrated resource teams, next slide please, individualized resource mapping, asset development, customized employment, specific best practices dealing with service delivery to youth, ensuring an adequate network of providers, issues dealing with data collection, and finally monitoring and continuous improvement. What I'm going to try to do in the next 10 or 15 minutes is not give you a comprehensive review of all of the practices that were identified based on reviewing these methods of administration plan, reviewing information developed by the DEI grantees, reviewing information provided by probably 15 states who are part of the EO committee at NASWA. This is not possible to give you a comprehensive recitation of all of the practices we identified, but we want to just give you, in the next couple of minutes, examples of some of the practices under the different topic areas. So let's start with a dedicated staff. And again, what I'm doing here is just sharing what's happening around the country. This is not developed in Washington, D.C. This is just sharing with you some of the practices, the innovative practices that are being used by American Job Centers around the country. So in terms of dedicated staff, there are centers that are actually assigning specific individuals with expertise regarding the provision of services and supports to people with disabilities. This is to help individuals with disabilities navigate the sometimes complex system or different programs under which they may be eligible, providing support to staff when they have questions, leveraging funding, conducting outreach to the disability community, and providing training. Next slide, please. We identified a whole number of significant marketing and outreach practices, but let me just share a few in the next couple of minutes. Simple things like when you make general presentations. Some of the American Job Centers are calling out and saying, and by the way, we provide special services to ensure effective and meaningful opportunity for people with disabilities. To send the message that they're welcome at the American Job Centers. Working with employers and employer groups to understand the value of flexibility in customizing employment to recruit and hire a diverse workforce. Offering customized training. Next slide. Some American Job Centers are conducting outreach by including speakers with disabilities, sending again the message of inclusion for people with disabilities, holding tours in partnership with disability groups, making sure that all off-site presentations are fully accessible for people with disabilities, and providing notices to entities and groups. Next slide. The next category of practices deals with consultation with community groups. Communication is absolutely critical, and not only a one-time communication, but developing a collaborative partnership, which would include ongoing cross-training of these groups. And some of the topics that we identified in our survey was disclosure of disability. When should and how should an individual disclose their disability? What are the advantages? What are the disadvantages? Making sure that people understood their rights and when disclosure was appropriate, permitted, etc. The work incentive provisions under SSI and SSDI, the responsibilities for providing accommodations to people with disabilities, and some of the resources that are available, including, for example, the Job Accommodation Network. Next slide, please. Other American Job Centers paid particular attention to developing practices for ensuring operational collaboration amongst the partners, to have a common intake form, the concept of no wrong door, that a seamless system, so that an individual came in, there'd be just one intake form. They may go to VR if they needed vocational rehab, if they needed comprehensive VR services. But otherwise, they were welcome to receive the services and supports by the American Job Center staff and the partner agencies. And develop a universal release of information form was also identified and developed by a number of American Job Centers around the country. Next slide, please. We also identified the importance of these formal partnership and linkage agreements, establishing working groups of mandated and non-mandated partners, including the WIPA benefit counselors as part of the team, the service coordination team. Also very key. Next slide, please. In terms of training of staff, there were a number of American Job Centers that conducted cross-training to promote relationships between various partners and community organizations, providing not just one-time awareness training to staff and partners, but doing this on an ongoing basis regarding best practices, civil rights, responsibilities, obligations, local and national resources, and work incentive provisions. Next slide, please. A number of American Job Centers around the country are participating in ETA's Workforce 3.1 website, the Disability Employment Community of Practice, where one-stops around the country are sharing with others what works and what doesn't work, but particularly the practices that have made a difference in enhancing effective opportunities for people with disabilities. Next slide, please. In terms of the practice of registration and orientation, a number of one-stoppers are saying, you know, privacy of people with disabilities is critical. So, and we don't know who walks in the door who has a disability, and so maybe we should routinely offer all new customers the option to talk in private offices. Offer all folks accommodations, so again, you're not identifying necessarily people with disabilities. Next slide, please. Including during orientation sessions, presentation of customers' rights, including customers with disabilities, listing of the auxiliary aids and services, sending a message that we actually can provide effective opportunity for folks. Packet of information regarding disclosure rights. Again, very important for people with disabilities to understand fully when they can or must or should disclose their disability. Very important. Next slide, please. A number of job centers around the country are establishing person-centered employment planning, starting with a simple concept of expectation of success, that people with disabilities can effectively be served by staff at America's Job Centers. And there's not a need, as we had under JTPA and the CETA program, to automatically refer to VR or other programs people with disabilities. To also start and focus on the strengths of people with disabilities, not their deficits. Next slide. To develop individual plans for employment using the important principles developed by DEI grantees around the country for career exploration and using the career exploration discovery process. Helping job seekers create presentational portfolios in addition to traditional resumes. Providing self-advocacy training for job seekers with disabilities, not only in terms of their rights, but again, how to approach an employer, when to identify voluntarily, when not to, why it might make sense to do it. For example, if you have an employer who's also a government contractor subject to the new Section 503 affirmative action requirements. Next slide, please. We learned about folks who were using integrated resource teams, helping folks where there are multiple service providers and resources to help navigate the systems and help coordinate these resources, particularly when you're dealing with possible funding sources from the Medicaid agencies, from the mental health and developmental disability agencies in the state. Next slide, please. There are a number of America's job centers around the country who are using individualized resource mapping to help sort through the maze of resources, the blending and braiding of funding. Next slide. There are those folks who are also employing asset development strategies to enhance long-term economic self-sufficiency of individuals with disabilities, including financial literacy training, individual development accounts, using Social Security work incentive provisions, particularly the PASS program, tax credit and opportunities, and self-directed benefit and resource accounts. Next slide, please. A number of America's job centers are taking advantage of customized employment, which has a process that has developed over the years with the leadership of ODAP and others, which provides an avenue for the employment for job seekers who believe that the traditional job search methods have not addressed and met their needs. So developing this flexible process, individualizing the relationship between the job seeker and the employer, based on individual determinations, discovery of strengths and interests, using this process on an individual and or a group basis of discovery. Again, focusing on individual strengths, priorities, interests, as well as their needs. This customized employment often takes different forms, task reassignment, job carving, as well as self-employment. Next slide, please. There are a number of America's job centers who are developing specific strategies for dealing with youth that they serve, including exposure to school-based preparatory experiences, career preparation, leadership, family involvement, and support. Next slide, please. Ensuring an adequate network of providers is also deemed critical by a number of America's job centers around the country. And they are integrating services and blending and braiding funds. And I'm going to ask Michael at this point, if it's possible, for you to share some of the experience by the Disability Employment Initiative grantees where America Job Centers are actually becoming employment networks and the very positive outcomes from that, those initiatives. Michael, are you able to join?
Yes. Thanks, Bobby. One of the features of the Disability Employment Initiative, which is a joint project of ETA and ODEP, is that any of the successful applicants, meaning states over 4 rounds now of funding, are required to become actively involved in the Ticket to Work program and help their workforce investment system at a local and or state level become employment networks, or what are called ENs as an acronym. And what we are seeing from preliminary data just recently is that there is a tremendous increase in participation of individuals with disabilities who are Social Security beneficiaries or recipients of SSI or SSDI, and that the result is very favorable outcomes related to employment. So it's in its early stages in terms of review of the data, but it seems to be there, no question, there are over 100 American Job Centers which have become employment networks, and the majority of those, the very large majority of those, became employment networks through assistance under the DEI initiative. So again, it's another method of looking at multiple funding streams across service delivery systems and truly finding added ways to be responsive to the job seeker with disabilities through the workforce investment system and other partners. So I think it's, again, proving to be a very promising practice.
Thank you, Michael. Next slide, please. A number of America's Job Centers are recognizing, in terms of establishment of their data collection systems, that it is absolutely critical to determine how some of they are meeting the needs of some of the subpopulations, including individuals with disabilities. And they are developing the capacity to analyze data to see how they are doing with respect to participation in core, intensive, and training services. In other places, if you ask the question, how many people with disabilities get training services versus core, the answer is, I don't know. Well, other agencies are saying, using the old maxim, what gets measured gets done, and they say, well, we need to see how we're dealing with meeting the needs of people with disabilities for core intensive as well as training services. Next slide, please. The final topic area deals with monitoring and continuing improvement. Some centers are recruiting a team comprised of folks with disabilities as part of their monitoring continuous improvement teams. Some are engaging in their own secret shopper. Michael made mention of that as one of the projects for the LEAD center, but a number of centers around the country are already adopting that process. And then they're developing action-oriented plans to address the barriers that they've identified or the needs that remain unmet. Thanks for the opportunity to share some of these examples of innovative practices that American Job Centers are adopting around the country.
Thank you, Bobby. Again, I think this work is going to yield even more examples over time as we continue to work with ODEP, NASWA, National Association of State Workforce Agencies, with ETA, Employment and Training Administration, with the Civil Rights Center, and others. And we really are mapping really unique ground, helping document the fact that the workforce investment system not only can be, but is in fact being, finding ways to be responsive to the needs of job seekers with disabilities. So I hope with the examples we've given you today, both with the Independent Living Center pilot project and with our policy project working with Bobby on identifying promising practices within the workforce investment system, you've gotten more of the depth of what the LEAD Center is working on and will continue to work on in year 2. I do want to express my personal appreciation for the project director for the LEAD Center for our first year was Karen McCullough. And Karen brought to us a unique blend of both passion and commitment to these issues, but also an enthusiasm for the opportunities presented by the LEAD Center to really identify promising practices, build up capacity of the workforce investment system to serve people with disabilities. And I think most importantly, the true power of the LEAD Center was in its ability to build and create partnerships. And Karen was our absolutely outstanding leader in building those partnerships with so many other national organizations, both in the disability community and outside it. So I want to personally thank you, Karen, for what you helped us do in year one, and appreciative that you're still working with us as Director of Special Projects in year two. But I want to turn it back to you for some further comments.
Hi, this is coming back to Karen. Well, Michael, thank you for all those wonderful compliments. And I am absolutely thrilled to still be working on the special projects, which will continue through at least Q1 of year two. And it is a great privilege for me, and I'm joyful. I said this to Rebecca when I recently talked with her. I was joyful that she's come on as the new LEAD Center project director, and I would love to have her share with us what the plans are for year two, so that maybe this time next year we could have another update on year two accomplishments. So Rebecca, can you fill us in on what's happening for year two? And again, thank you very much for coming on board. I'm looking forward to your leadership.
Thanks, Karen, and thanks for all the support you've given to me in the few weeks that I've been here. I'm thrilled to have joined the LEAD Center staff and to be part of the momentum that has happened in year one. There's just been an enormous number of accomplishments. You've heard just a few of them today. We want to leave a little time for questions, so very briefly I'll give you some highlights of the plan for year two. We're going to be building on what was accomplished in year one, so the focus will be on leveraging year one findings to develop training and technical assistance materials, to improve capacity of workforce professionals, to effectively serve job seekers with disabilities, and connecting job seekers with disabilities to AJCS. So as you heard in these previous presentations, there's been a good foundation laid, and we want to build on what people have learned, figure out how to bring that to scale. We're going to be developing tools to support job seekers, understanding and their use of AJC services, share best practices, and connecting CILs and their customers with AJCs. And again, you've heard about the terrific foundation that's been built. We're also going to be working with the Families and Work Institute. They conduct national surveys, both with employers and employees. This year, they're going to be conducting a national study of the changing workforce, and the LEAD Center is going to be playing a role in that. So they'll be surveying people across the country on their access to and use of flexible work arrangements, and the use of those findings to develop new tools and training materials. Some other things that we'll be doing this year, you heard about the projects, some of the work in customized employment. We'll be providing training and technical assistance to selected AJCs in Kansas and Illinois to integrate group discovery and customized employment, and a lot of that work has been going on this year. It'll build on what the tools that they've developed and the curricula that they are developing. They're developing facilitation manuals and doing trainings of trainers to bring both customized employment and discovery to the AJCs. You also heard about the webinar series from last year where there were 9 webinars. We, again, will be designing and delivering a multi-part dynamic webinar series on topics that have been identified by LEAD Center stakeholders. We'll be holding an additional annual policy roundtable in year 2 and identify systems issues and develop policy recommendations and tools to overall improve integrated service delivery, employment, and economic advancement outcomes for adults with disabilities, which is, of course, the mission of the LEAD Center. So I'm very excited about being here. I'm excited about what's been accomplished and what we will be accomplishing in year 2 and going forward. So thank you, Karen, for all that you did in year 1 and to the rest of the LEAD Center staff. And now I'll turn it back to Elizabeth for questions.
Excellent. Thank you, Rebecca, and thank you to all of our speakers today for your dynamic presentations and providing us a very thorough update of some of the efforts of the LEAD Center's Year 1 project. I'd now like to invite you to submit your questions either into the Q&A box or into the chat box. While you do that, I'm going to take a minute to tell you how you can learn more about the LEAD Center. Please do visit us at www.leadcenter.org. There you can view archives of each of the webinar mini-series that we held in the first year. As you know, those mini-series were targeted around employment, economic advancement, and leadership or public policy. The mini-series is available via archive. You can also download the presentations as well as the transcript. You can also go through the website to sign into our listserv, which will allow you to receive updates and announcements about our Year 2 trainings and events. You can sign up for our different social media platforms. You can subscribe to the LEAD Center Lead On e-newsletter, as well as viewing some of the archives of that newsletter from Year 1. Okay, we do have a few questions in the chat box, and I encourage you to keep sending those questions in as we do have some time to provide answers. Our first question is for Angie Siegler and for Karen McCullough regarding the CIL pilot. Our question is, are you planning any evaluations of how training is being put to use in the AJCS in the future to gauge the effectiveness of those trainings? I wonder, too, if you could please provide for us, Karen, as an intro to that answer, some of the other trainings that the other CILs have been providing to AJCS so we can have a greater picture of the training AJCS are receiving, and then your plans for any evaluations on how those trainings are being put to use by the AJCS.
Hi, this is Karen, and I wanted to follow up. It's a great question. And yes, we have had CILs that have done trainings on the Americans with Disabilities Act, on accessibility issues, on vocational rehabilitation, on independent living services that are provided by CILs, and also how to do referrals both ways, from AJCs to CILs and from CILs over to AJCs. And as far as the evaluation of the trainings, I was sitting here thinking about that because we are going to do an evaluation, which actually I've been in conversation with some of the CILs already at the end. But let me just check in with Angie, because I think it's Paraquad that has done the majority of the training, not all of them, but the majority of the training. Angie, how have you followed up, or have you, in evaluating the effects of your training?
We have. We've worked with the AJC, and we send in secret shoppers in addition to our, 10 participants that we're working with in this project. So we send in secret shoppers each month, and we share the results of their, experiences at the AJC. And we meet with several of the Paraquad staff, meet with several of the managers at the AJC monthly, and we discuss issues, and then we use that to decide what we might need to train on again in the future. And, that really helps kind of serve as the compass to figure out where we need to go.
Thank you. And I'm not for sure that answered the question, but it certainly has my mind going a mile a minute, because I think that we still have more trainings that will occur. The responses we've gotten from the CILs, for instance, that are doing the disability awareness and etiquette training, because many of them have already done that, have gotten extremely good responses from the AJC staff on that training. And I think Bobby made an excellent point about this is not just a one-time opportunity to do this, but it needs to be ongoing because staff does change. And that type of awareness and etiquette is important on communication effectiveness with people with disabilities. So, but that question has got me going, and I think maybe we probably should talk with the CILs about developing an instrument that would just very briefly be handed out after a presentation is done for a training to get some of the AJC staff feedback, because I think that ongoing collaboration is a very important thing and also on what other kinds of training do you want. So thanks for that question, and thanks, Angie.
Karen, we're going to stick with you and ask one more question about the CIL pilot.
Okay.
The question is the CIL toolkit for job seekers, the Awareness and Etiquette Guide, the Job Center Guide, and the glossary available for download?
Okay, terrific question. Thank you for asking that. Because we're looking at developing a replicable model for this and working very closely with Nicole. And Chris, I know, Chris Button is still on with ODEP, but I think once that we have all of the documents the way we want them, we do anticipate that these would be available as a download on the www.leadcenter.org website. They are not available as yet, but we will be making those available, and they will come along with whatever models are finally developed for the replication of it for Centers for Independent Living across the country. And I do want to say this because, and you know, it's one of those things where you wish you had said something and you didn't do it. And I remember I want to say this. The unemployment of people with disabilities still has very high levels of people who are looking for jobs. And what I want to agree with Chris and others is we are beginning to see some systems change. And I think that's what it takes. And this partnership that has been developed between Centers for Independent Living, who have a core service that is directed towards peer counseling, can make all the difference in the world in them sharing their area of expertise and working with people with disabilities all the time with the AJCs. And the AJCs have services that the CILs don't. And so for me, this makes a perfect partnership in working with people in these two groups in collaboration across the country. I think it can make a huge difference if we have more and more CILs doing this kind of partnership. So thanks very much. Elizabeth, do you have any other questions?
Thank you, Karen. Our next question is for Michael and Bobby. The question is, at one point, I understood the LEAD Center intended to take a fresh look at workforce development's performance objectives. Can you please provide an update?
Yes, thanks, Elizabeth. The performance measures under the Workforce Investment Act have been an area that we have begun to look at. We had commissioned some policy analysis and work with Chris King, who is a faculty member at the University of Texas School of Government, LBJ School of Government. And we do expect to work as well, we hope, with folks at NASWA, the National Association of State Workforce Agencies, to see whether we can develop some fresh and creative recommendations that make sure that there are no disincentives to serving individuals with multiple barriers to employment, including individuals with disabilities. So it is on our to-do list. We have started some policy analysis of what some states have looked at, but this is work that will continue in year 2 of the LEAD Center.
Thanks, Michael. Well, that concludes all of our questions. I'd like to offer if Rebecca or Michael would like to add one more comment, and then we're going to open up the line for our partners at ODEP for a final word.
I thank you, Elizabeth. Again, I think it has been a very busy and very productive first year. We are excited about the opportunities to continue to build new knowledge about promising practices and also to continue to improve ways people with disabilities can be served and supported by the workforce investment system. I think our partnerships will remain strong, and we're particularly appreciative of the team at ODEP that we work with, and all under the leadership of Kathy Martinez as the Assistant Secretary at ODEP. I think we will have a great second year.
Elizabeth, this is Chris Button at ODEP, and I want to really thank everyone for their participation in the webinar today, all of the LEAD staff and partners, contractors. And I want to thank everyone across the country who has been listening in to hear about the exciting first year that the LEAD Center has done, and hear a little bit about what we're thinking about for year 2. I think that, to me, Michael really captured it earlier when he said that we're really trying to kind of go beyond thought and abstraction to learning what can we learn, what kind of new knowledge can we build through our special projects, and the impact then on policy, and actually coming up with recommendations for policy development. And we're doing that in a number of areas that started out this year, either as a special project or as a policy analysis paper, and we'll be taking it to the next level next year across a plethora of areas. And it's been a wonderful year from ODEP's perspective. We are really excited about moving forward into year 2. I want to reiterate Michael's accolades and thanks to Karen McCullough for her incredible leadership in year 1, and we're so pleased that she'll be staying on for a while as our special projects director. We want to welcome Rebecca. We're really excited to bringing you onto the team, and look forward to continued collaboration with all of our various partners and with you stakeholders and interested folks across the nation as well, because you're all a part of what we're doing and trying to get to that building of new knowledge and figuring out what's the best way to move the needle on increasing employment and economic advancement for people with disabilities. So thank you.
Thank you, Chris. One last thank you to our incredible speakers today, Kelly Buckland, Angie Siegel, Bobby Silverstein, Michael Morris, and Karen McCullough, and Rebecca Salone. And thank you to all of you for participating. We value your input, and if you have some thoughts about trainings for next year, please do it. Send me an email, ejennings@ndi-inc.org. That concludes our webinar for today. Thank you very much. We look forward to seeing you on trainings in 2014. Have a great day, everyone.